Come in.
Hi, my name's Grace. I'm going to be a physician assistant student working with you today. Before we get started, can I just confirm your name and date of birth?
Sure. Arnold Stanton Jr., 2/27/1970.
Okay, is there anything else I can get you before we get started?
Mm-mm.
Okay, well, so what brings you in today?
Yeah, I'm having really bad stomach pain and diarrhea.
Okay, can you tell me a little bit more about that?
Yeah, I started having really bad stomach pain about 3 days ago, and then the diarrhea came with that.
Okay, where exactly is your pain?
It's right over here.
So what about your left upper hand quadrant?
Mm-hmm.
Has that pain spread to any other areas?
No, it's just consistent there.
Okay, on a scale of 1 to 10, how bad is the pain?
I'd say about a 6.
Can you describe the quality of the pain?
It's a sharp pain.
It's pretty sharp.
Yeah.
Okay. You said it started about 3 days ago. Has that pain been pretty consistent for the past 3 days, or has it come and gone?
It started gradually, and then now it's just really bad, and it won't go away.
So when it first started, what would you rate it on a scale of 1 to 10?
I'd say about a 2.
A 2. Okay. Well, have you tried anything to make those symptoms better?
I don't really know what to do.
Okay.
To
Has
make it
anything made it worse?
No.
No? Okay. So you haven't really tried anything in either direction?
Mm-mm.
Okay. You mentioned your side pain, but have you had any other symptoms along with the diarrhea and stomach pain?
No. Some fever.
A little bit of a fever?
Yeah.
Okay. Well, what's your main concern regarding your stomach pain?
The diarrhea won't go away. My stomach is just the pain is getting worse. I don't know what to do anymore.
Okay, well, it sounds pretty debilitating.
Yeah.
Well, I'm just gonna move along and ask some questions that I ask all my patients.
Okay.
Can you talk to me about your past medical history, such as childhood illnesses or any surgeries that you've had?
I haven't had any surgeries. I also don't think I've ever had any kind of childhood sickness or illness.
Okay. Do you have any current medical conditions?
Yeah, I was diagnosed with chronic back pain, some hypertension, and right now I do have a bad bout of sinusitis.
Okay, and are you taking any medications for those illnesses?
Yeah, I'm taking lisinopril for my hypertension.
Okay.
And my doctor prescribed me Augmentin for my sinusitis.
Okay, and for both of those medications, how much are you taking and how frequently?
For my hypertension, I'm taking about 20, I think it's 20 milligrams a tablet orally. Oral.
Okay. Mm-hmm.
Twice a day.
Yeah.
And then my Augmentin is 250 milligrams twice a day.
Okay, and you said your doctor prescribed the Augmentin for you for your sinusitis, and you've had that for a couple weeks now?
Mm-hmm.
Okay, and so how long ago did you start the Augmentin?
I started it, I think, 7 days ago.
Okay, and your symptoms that you're having now started 3 days ago? Okay. Well, is there anything you're allergic to? Any medications?
I'm allergic to aspirin and penicillin.
Okay. I'm also going to ask some maintenance questions, some health maintenance and screening questions. And these are things I ask everyone just to make sure you're up to date on all the things you need for your health.
Mm-hmm.
It says you're 49 years old, and at age 50, we recommend all of our patients to get a colonoscopy screening for preventative measure for colon cancer. Is that something you've considered scheduling in the future?
Yeah.
Okay. That's something that's coming up pretty soon.
Okay.
Have you had a prostate exam recently?
No.
You have not? Okay. That's something that's also important just to check and make sure that there's no cancer or any other issues going on. Are you up to date on your vaccinations, such as pertussis, your MMR, your Tdap?
Mm-hmm.
Have you had the flu shot this year?
Yes.
You have? Okay, well, that's good to hear.
Mm-hmm.
I'm now just going to ask you some questions about your background, and your family life, work life. What do you do for a living?
I'm an electrician.
You are? Okay. Can you tell me a little bit more about that?
Well, I after graduating high school, I took a couple classes, learned, how to be an electrician, and I've been doing that for the last 15 years.
Okay. Do you live with anyone, or?
I live alone. I'm
live
divorced.
alone. Okay. Do you use tobacco?
No.
Do you use any illicit drugs?
No.
Marijuana?
No.
Do you consume alcohol?
I have a couple beers every day.
Okay. So how many beers exactly would you say you have?
I'd say about 2.
About 2, and that's every day of the week?
Like 3 times a week.
Okay. And have you traveled recently?
No.
No? Okay. Now I'm just going to ask you some questions about your family and your medical history. Has anyone in your family had a history of heart disease?
No.
What about a history of diabetes?
Not that I know of.
Hypertension?
Yeah, my dad had hypertension.
He did, okay. And anyone else have a history of hypertension?
Nope.
What about cancer?
No.
No? Okay. Now I'm just going to ask you some other general questions about some symptoms.
Okay.
You mentioned you had sinusitis, and those symptoms have started to go away. But do you have any headaches?
No.
Do you have any vision problems? Difficulty hearing?
No.
So no congestion anymore?
No congestion, no.
No congestion. Have you had any difficulty breathing?
No.
What about like, upon exertion with exercise? No. Other than your localized stomach pain, have you had any other stomach problems?
Before today or this week?
Yeah.
No.
How are your bowel movements? Are you going to the bathroom frequently?
Well, yeah.
If you're diet?
Yeah.
Do you have any chest pain?
No chest pain.
Okay. What about your mental state? You mentioned you were divorced. How are you doing with that?
I mean, it's hard. My kids live with their mother, so I don't see them often. It's been hard, but what can I do? I'm taking it day by day.
Do you have a family history of depression or
No.
no mental illness? So it's just something that you're taking in and
Yeah.
is there anything you do to help with those symptoms, such as like exercise or?
I'm not really a big fan of exercise.
No? Okay. That is something that's super important. Just to keep your heart healthy and to manage your weight. It'll also make you feel good when you do exercise. So that's something that you would like to incorporate into your day. Even if it's just small bouts, it can help quite a bit. But so we're gonna look further into your stomach pain.
Okay.
And we're gonna help get to the bottom of this.
Sounds good.
All
Thank
right.
you.
Thanks for coming in.
Great.